Thank you, Vincent, very much for that warm introduction, and thank you for the invitation to come and participate in this wonderful meeting. As per WFH requires, I'm disclosing that I don't have any conflicts of interest. And just to get started in terms of what we'll be covering today, I'll provide a brief background and overview of PCORI, the Patient-Centered Outcomes Research Institute, but I'd like to spend most of the focus of my talk today on how PCORI facilitates and operationalizes patient engagement in research. And I'll share a little bit about the lessons that we've learned along the way and looking ahead, and then we'll follow up, of course, at the end with some Q&A. So what is PCORI? PCORI is an independent research institute that was authorized by Congress in 2010. We're governed by a 21-member board that represents the entire healthcare community. We fund comparative clinical effectiveness research that engages patients and stakeholders throughout the entire research process. And through our research, we seek answers to real-world questions about what works best for patients based on their circumstances and concerns. So our mission ultimately is to help people make informed healthcare decisions and improve healthcare delivery and outcomes. And we do this by producing and promoting high-integrity evidence-based information that comes from research that's guided by patients and relevant stakeholders. Our three strategic goals are to increase the quantity, quality, and timeliness of useful, trustworthy research information available to support health decisions, to speed the implementation and use of patient-centered outcomes research evidence, and to influence research funded by others to be more patient-centered. So who are our stakeholders? Our stakeholders essentially are anyone that has a stake in the delivery or use of healthcare. Contrary to popular belief, while our primary stakeholder group is patients and caregivers, we also do have several other stakeholders, including hospitals, health systems, training institutions, policymakers, and industry partners. In terms of how we engage our stakeholders, we do this in a number of different ways. For one example, we have our merit review panels where patients and stakeholders participate in that process and help us in terms of identifying what research projects we should and should not fund. We also have patient and stakeholder partners that participate in our advisory panels that really assist in informing our strategic goals and our evaluation efforts. And we also engage stakeholders through webinars, workshops, as well as our funding mechanisms. The research that we fund, is guided by our national priorities for research and is broken down into 5 program areas. All of our research scans all across all of these different program areas, so we have a very diverse portfolio. Our portfolio is also growing. As of the start of this year, we have funded over 650 projects and awarded over $1 billion. In terms of the concentration of our funded projects, majority of them lie in the mental and behavioral health sphere, followed by cancer, cardiovascular health, nutritional and metabolic disorders, neurologic disorders, rare disease, and lastly, respiratory diseases. So as I mentioned earlier, we fund comparative clinical effectiveness research, which is research that generates and synthesizes evidence comparing the benefits and harms of at least 2 different methods to prevent, diagnose, treat, and monitor a clinical condition or improve care. So when I explain CER to investigators or folks that are newly introduced to PCORI, I like to use the classic car buying example, if you will. When you go out to purchase a car or even a cell phone, you have a whole host of information. It almost seems like information overload. You've got details on mileage, on specs, on aesthetics, and the list goes on. And you have to really sift through all of that information. But when it comes to clinicians and patients making informed decisions about which treatment option to choose over another for their particular condition, sometimes that evidence is not always there. And that's why CER is so important, because it's through this research that that evidence is generated and synthesized so that those can make more informed healthcare decisions. It's important to note that PCORI does not fund cost-effectiveness research. So we fund PCore, which is patient-centered outcomes research, which is a relatively new form of CER that considers patients' needs and preferences and the outcomes that matter most to them. Some folks often describe PCore as patient-centered CER, in that it's characterized by having active and continuous patient and stakeholder engagement throughout the entire research process. In order for research to get funded by PCORI, it has to satisfy these 5 criteria, and it's important to note that 2 of the 5 criteria have a specific focus on patient-centeredness and patient and stakeholder engagement. And that's really what sets us apart from other major funders like NIH and others, in that we have a specific focus on patient-centeredness and patient and stakeholder engagement. So this is just another visual that sort of helps to explain and depict what we mean by engagement and what makes PCORI different, in that the research that we fund, again, has to have active patient and stakeholder engagement from the very beginning, topic selection and research prioritization, throughout to the design and the conduct of research, dissemination and implementation of results, and ending with evaluation. So this is a key thing that distincts us from other funders, is that we need those strong elements of patient and stakeholder engagement throughout the entire research process. I want to show you a short video where you'll hear from a number of different stakeholders. That this video, I think, will help to further describe what makes PCORI different and what we mean by engagement. See if it works.
I want to welcome you to the PCORI family. The notion that we've got is that we are problem solvers together.
You have to sort of get patients involved in the entire cycle of research, from the original designing of the studies all the way through to the dissemination and feedback.
Our accountability is to patients. Ultimately, we're going to be listening to a lot of stakeholders, but our true north is going to be patients. And when I say patients, Gail will remind me of patients and their caregivers.
We need to move away from token patientism. And while the diseases that we all represent are critical, we need to find ways to really represent patient, not centered research, it's patient-driven research.
First things first, it comes back to having the patient every step of the way.
We've got to get better information out there for different population groups so our research looks like the country that we're trying to serve.
And what I see is a major paradigm shift from an expert-dominated medical decision-making, where the patient's role as a passive recipient of a treatment, to a truly patient-centered health care.
We recognize that maybe there's room to turn the world upside down just a bit.
Okay, so some key phrases and terms that come out of the movie, that video, that always strikes me as paradigm shift. Obviously, research done differently, research that looks like the world and the communities that we're serving. Oftentimes, folks describe PCore and PCORI as both innovative and disruptive. Innovative in the sense that we are taking this new approach, if you will, to the conduct of research by engaging patients and stakeholders throughout the entire process, but disruptive in the sense that it challenges some of the traditional research norms, if you will, in terms of the conduct of research. So it's actually a perfect segue because now I want to talk about some of our specific efforts surrounding engagement. $1 million question that we always hear is, why engage? Does it really make a difference? What's the impact? And there are a number of different reasons: to influence research to be patient-centered, relevant, and useful, to establish trust and a sense of legitimacy in research findings, and to encourage the successful uptake and use of research results. So if ultimately the end goal of our research is to help patients and stakeholders make better informed decisions, it almost seems like it's counterintuitive to not involve them in that process, in the conduct of the research. So does engagement make a difference is another question that we always, hear. What's the impact? And to that end, we always cite a systematic review that was conducted that provided evidence on the impact of patient and public involvement on research in health and social care research. And while the authors did note that the evidence surrounding patient engagement in research is lacking and it needs to be enhanced, they did also find that patient and public involvement enhanced the quality and the appropriateness of research. I want to show another short video, and in this video you're going to hear from 3 female patient partners who are engaged in projects that are in our asthma portfolio and our Addressing Disparities portfolio, and they're speaking to what being an engaged research partner in a study meant to them.
I was a little intimidated because at first it took a minute to really figure out what my role was going to be. And it was like, okay, so what am I going to do? In the other studies that I was involved in, I was more the person being helped. Whereas in this study, I feel like I'm on the other side along with the researchers of helping find out what we can do to get the information from the patients. So I know one of the major things that we helped with was helping them understand more about the apprehension that the patients will feel. My mom is one of those kind of people, if you come in her house with an iPad, she's going to send you back outside. My mom, by the way, is an asthma patient, and she totally mismanages her asthma. She doesn't listen to anybody. And, so, if you're supposed to be helping her, a medical person, she doesn't want you with anything that looks remotely like a computer. It's the funniest thing to me. And it's like, Mom, I work with computers. I don't want them studying me and seeing it, But anyway, long story short, I brought up that kind of stuff, and they were like, oh, okay, we didn't think about that. So it turned out that I had a lot to offer, so I was really grateful for that. Anything you bring, no matter how small it may seem, anything that you say, any ideas that you have will be valued. And, a lot of things that I didn't see or think that would be that important turned out it was, something that was really good.
I think I play a valuable role, and I don't think I really realized how much until we went to a conference and I participated in one of our presentations about the patient, the provider, and the researcher. And I don't know, it just seemed to be a hit with everybody that was there. It's dealing with shared decision making, and we try to get the patients to participate more within their treatment. A lot of times the patient goes in, they tell the doctor what's been going on with them. The doctor tells them, okay, well, this is what you need to do. But then the patient never told the doctor how the last time they took the medicine, they had some adverse reaction, or maybe the medicine cost too much, so they had to decide between buying the medicine and buying something else. So the doctors are making decisions based on an incomplete amount of knowledge, and it's not always the best decision for the patient. So we want the patients and the doctors to work together. I feel like when I'm a part of the research team, I represent other patients or other families who are dealing with asthma, and in many cases, patient voices aren't really heard or they may not be acknowledged. So I feel like I represent them and I advocate for them. That made me feel proud to be a part of that research team, and they were happy to have me.
I knew this was going to be my opportunity to really learn about asthma in a way that I really wanted to learn about it. That's what made me want to do the study. Every time we do something, I'm learning more and more about asthma and the study and what we're trying to do. We're bringing experience from our place as a mother and also as the breadwinner and the main one doing preventive measures for our children. If it was just us and our group, people would hear us, but would something be done about it? For the parents and the doctors, the coaches, everybody could pull together, take our concerns as parents, and bring up some type of action that could help a little bit. We kind of became kind of like a family of people with the same common interests, and our group is so diverse, like they're real, and that's very rare. If it's something bothering me, I can talk to them. They're not too big and too above to talk to little old me. Then to hear the professionals say we inspire them, it kind of makes you feel good inside. It makes you feel like, you know, we're all in this together.
Be open, be honest. You don't have to water it down. Whatever it is you have to tell in your story, don't be afraid to tell it.
Know that what you have is valuable. And what you have and what your experiences are valuable.
You're going to come out more informed and with more hope than before you went in.
So I'm going to jump ahead a little bit in the presentation, just simply in the interest of time, and focus now a little bit more on what we have done to facilitate engagement. And one of our most powerful tools, if you will, is our engagement rubric. This is the framework by which PCORI views patient and stakeholder engagement. There are three main elements: planning the study, conducting the study, and disseminating the study results. And essentially what the rubric does is it provides a host of examples and activities that researchers and individuals on the research team can engage in so that there's actual meaningful patient and stakeholder engagement. So in terms of planning the study, the ways that patients and stakeholders are engaged are assisting with constructing the research question, identifying relevant outcomes and comparators. For conducting the study, reviewing the public-facing or patient study materials, and then for disseminating the study results, stepping away from sort of the more traditional avenues and platforms for sharing research findings in scholarly journals to focusing more on participating in conferences, summits, and other platforms where patients and stakeholders actually will be able to receive the information. Our key engagement principles are reciprocal relationships, co-learning, partnership, trust, transparency, and honesty. And all of these elements must be embedded within the research process and in the patient and stakeholder engagement plan in order for these projects to really and truly be successful. Our engagement rubric is not meant to be comprehensive or prescriptive. It's a guide for applicants. It's a guide for researchers. It's a guide for patients and stakeholders. And it's also a living resource. So we're constantly looking to the field to determine and find new activities and new ways in which we can enhance our patient and stakeholder engagement rubric. One element that we're beginning to start the process of adding is the pre-engagement activities. So looking before the planning the study and focusing more on those partnerships and the capacity building and the infrastructure that's necessary to have meaningful engagement. Some additional tools that we have to support patient engagement is through our personnel, specifically through our engagement officers. As Vincent had mentioned earlier, the engagement officers are basically a bridge between science and engagement, and our role is to ensure that there is meaningful patient and stakeholder engagement that's reflected in our portfolio. We assist researchers and folks on the science team with troubleshooting any sort of engagement challenges, and we also gather promising practices from the field to pour back into our programs, our support services, our resources that we develop. We also have a patient engagement advisory panel. It consists of sort of leaders in the PCore space, if you will, and they really sort of help to inform our strategic focus, our evaluation efforts, and other programs. We have programmatic funding that supports engagement, one being the Eugene Washington Engagement Awards. And this focuses more on increasing knowledge and awareness of PCore and building strong PCore communities throughout the United States. We also have our Pipeline to Proposal Awards, and this is where the focus is more on the pre-engagement activities. So the focus for our Pipeline to Proposal Awards is on strengthening the relationships, building capacity, engaging community partnerships. Majority of our awardees for these awards are community-based organizations or junior faculty members who need more assistance in terms of helping to form those partnerships with the community, identifying and determining who's going to be on their advisory panels, as well as constructing their CER research question. These are other examples of tools that we have developed and that are in development. So in terms of looking ahead, something that we hear often from the field is that engagement is hard. It's very difficult to do. There's challenges with respect to relationship building, maintaining them throughout, in between projects as well as after projects. There's challenges with respect to budgeting for engagement expenses. Challenges with respect to training and skill development, training that's needed on both ends, both on the researcher end as well as on the patient and stakeholder end. How much engagement is too much engagement? Should patients and stakeholders really and truly be engaged in every step of the research process? Is there one phase that's more beneficial to have their input as opposed to others? How do we engage hard-to-reach populations? These are sort of all of the common questions that we hear oftentimes, and we really look to the field to help to inform and answer those questions. But I say that to say engagement is hard, but I mean, research is hard. Conducting research is challenging. As a clinician, as a pharmacist, getting the patients to take their medications every day was challenging. But that doesn't necessarily mean it should stop you from moving forward and pursuing it. So some of the lessons that we learn is that communication is key. It's important to be clear in your communications. Transparency is pivotal. Mistrust takes seconds to form and years to deconstruct. Training is needed, again, as I mentioned, on both the patient and on the and on the researcher end. As researchers, as clinicians, when we're trained in universities where we don't have as much exposure and interaction with patients, and we're not taught how to engage patients in the way that we provide care and in the way that we conduct research. So there's a little bit of undoing that has to be done in relearning. Engagement is relational, it's not transactional, it's not a checkbox, it's an ongoing thing. Equity is critical and it's important. Mentorship is needed both for patients and for researchers, and this is about a culture shift. Researchers are typically what we've heard is researchers are afraid of patients and patients are afraid of researchers. Oftentimes that's the elephant that's in the room, and attacking it sort of head on and being clear in your communications will help to address some of those issues. So I just want to close off with a quote that I read recently in the book The Immortal Life of Henrietta Lacks. I don't know how many folks are familiar with the story of Henrietta Lacks, but she's basically was an African-American woman in Baltimore that a splice of a tumor cell that she had, she died of cervical cancer, was used for the advancement of science and the advancement of research, but it was taken without her consent. And as I was reading the book, I found that there were some parallels, if you will, between that time and what we're undergoing now in terms of this new approach to research with PCore, in that in her time, it wasn't uncommon for clinicians, researchers to not obtain patients' consent, and in our time, it's not uncommon for researchers to engage patients and stakeholders in the research process. But through her story, there have been strides that have been made and constant changes in the research process. And through our story now with PCore, our focus now is more on engaging patients and stakeholders in the research process. We've come a long way, but we still have a very long way to go. And I challenge you all to just continue to work with us as we advance this field. Thank you.